Ocular motor palsies. In complete third nerve paralysis, there is ptosis with a divergent and slightly depressed eye. Extraocular movements are restricted in all directions except laterally. Intact fourth nerve, that is superior oblique, function is detected by the presence of inward rotation on attempted depression of the eye. Pupillary involvement is an important sign of differentiating surgical from medical causes of isolated third nerve palsy, that is, dilated pupil that does not react to accommodation or to light shown in either eye. Compressive lesions of the third nerve, example aneurysm of the posterior communicating artery and uncalled herniation due to supratentorial mass lesion, characteristically have pupillary involvement. Patients with painful isolated third nerve palsy and pupillary involvement are assumed to have a posterior communicating artery aneurysm until this has been excluded. Medical causes of isolated third nerve palsy include diabetes, hypertension, syphilis, and giant cell arteritis. Fourth nerve paralysis causes upward deviation of the eye with failure of depression on adduction. There is vertical diplopia that becomes most apparent on attempted reading and descending stairs. Many cases of isolated fourth nerve palsy are due to congenital lesion. Trauma is the major cause of acquired, particularly bilateral fourth nerve palsy, but cerebral neoplasms and medical causes such as in third nerve palsy should also be considered. Sixth nerve paralysis causes convergent squint in the primary position with failure of abduction of the affected eye, producing horizontal diplopia that increases on gaze to the affected side and on looking into the distance. It is an important sign of raised intracranial pressure. Sixth nerve palsy may also be due to trauma, neoplasms, brainstem lesions, or medical causes. An intracranial or intraorbital mass lesion should be considered in any patient with an isolated ocular motor palsy. In patients with isolated ocular motor nerve palsies presumed to be due to medical causes, brain MRI is performed. Ocular motor palsies occurring in association with other neurologic signs may be due to lesions in the brainstem, the cavernous sinus, or in the orbit. Lesions around the cavernous sinus involve the upper divisions of the trigeminal nerve, the ocular motor nerves, and occasionally the optic chiasm. Orbital apex lesions involve the optic nerve and the ocular motor nerves. Thank you.